Welcome to this pharmacology quiz series, where we explore key topics designed to test and strengthen your understanding of pharmacology. In this video, we will focus on sympathomimetic drugs. This group of drugs is used to manage conditions such as asthma, anaphylaxis, nasal congestion, hypertension, and certain cardiac disorders. The quiz consists of 10 recall-type multiple-choice questions covering important pharmacological concepts. Each question includes 5 options, followed by the correct answer and a brief explanation to reinforce learning. After each question appears, the video will pause briefly to allow you time to attempt the answer before the correct option is revealed. So, let's get right into it. Question 1. Which sympathomimetic drug acts primarily through indirect release of norepinephrine from presynaptic terminals? Option A, epinephrine. Option B, phenylephrine. Option C, amphetamine. Option D, dobutamine. Option E, isoproterenol. The correct answer is option C, amphetamine. This is because amphetamine acts indirectly by promoting the release of norepinephrine from presynaptic storage vesicles into the synaptic cleft. All the other options act mainly as direct adrenergic receptor agonists rather than increasing neurotransmitter release. Question 2. Which of the following statements regarding beta-2 selective sympathomimetics and their mechanism of bronchodilation is correct? Option A. They stimulate beta-2 receptors increasing intracellular cyclic AMP. Option B. They inhibit phosphodiesterase and reduce cyclic AMP breakdown. Option C. They block muscarinic receptors in bronchial smooth muscle. Option D. They reduce leukotriene synthesis within bronchial epithelium. Option E. They antagonize histamine H1 receptors in airway tissues. The correct answer is option A. They stimulate beta-2 receptors increasing intracellular cyclic AMP. The explanation is that beta-2 agonists activate adenylate cyclase through beta-2 receptors, increasing cyclic AMP and causing relaxation of bronchial smooth muscle. The remaining options describe mechanisms of other drug classes such as phosphodiesterase inhibitors, anticholinergics, leukotriene modifiers, or antihistamines. Question 3. Which sympathomimetic agent is most selective for alpha-1 adrenergic receptors and commonly used as a nasal decongestant? Option A, phenylephrine. Option B, isoproterenol. Option C, dobutamine. Option D, salbutamol. Option E, terbutaline. The correct answer is option A, phenylephrine. This occurs because phenylephrine is a selective alpha-1 adrenergic receptor agonist that causes vasoconstriction in nasal mucosal vessels, relieving congestion. The other drugs primarily stimulate beta receptors and are mainly used for cardiac stimulation or bronchodilation. Question 4. All of the following statements about epinephrine pharmacological actions and receptor activity are correct except Option A. It stimulates both alpha and beta adrenergic receptors. Option B. It increases heart rate through beta-1 receptor activation. Option C. It causes bronchodilation via beta-2 receptor stimulation. Option D. It lowers blood glucose by inhibiting glycogenolysis. Option E. It increases peripheral vascular resistance through alpha-1 stimulation. The correct answer is option D. It lowers blood glucose by inhibiting glycogenolysis. The reason is that epinephrine actually increases blood glucose by stimulating glycogenolysis and gluconeogenesis through beta receptor activation. All other options accurately describe the known receptor-mediated actions of epinephrine. Question 5. Which sympathomimetic drug is most appropriate for acute anaphylaxis because of combined alpha and beta receptor activation? Option A, norepinephrine. Option B, epinephrine. Option C, dopamine. Option D, dobutamine. Option E, isoproterenol. The correct answer is option B, epinephrine. This is because epinephrine activates alpha-1 receptors causing vasoconstriction, beta-1 receptors increasing cardiac output, and beta-2 receptors producing bronchodilation in anaphylaxis. The other drugs lack the balanced alpha and beta receptor profile required for rapid reversal of systemic allergic reactions. Question 6. Which of the following statements regarding dopamine pharmacology and dose-dependent receptor effects is correct? Option A. Low doses predominantly stimulate renal D1 receptors. Option B. Low doses primarily stimulate cardiac beta-1 receptors. Option C. Moderate doses mainly stimulate alpha-1 receptors. Option D. High doses predominantly stimulate dopaminergic receptors. Option E. High doses mainly inhibit norepinephrine release. The correct answer is option A. Low doses predominantly stimulate renal D1 receptors. This occurs because low-dose dopamine activates dopaminergic receptors in renal vasculature, producing vasodilation and increased renal blood flow. The other options incorrectly describe the receptor effects that occur at different dopamine dose ranges. Question 7. Which sympathomimetic drug is most selective for beta-1 receptors and primarily used in cardiogenic shock? Option A. Dobutamine. Option B. Salbutamol. Option C. Isoproterenol. Option D. Phenylephrine. Option E. Terbutaline. The correct answer is option A. Dobutamine. The explanation is that dobutamine is a relatively selective beta-1 agonist that increases myocardial contractility and cardiac output in heart failure or cardiogenic shock. The other drugs mainly stimulate beta-2 receptors or alpha receptors and are used for bronchodilation or vasoconstriction instead. Question 8. Which of the following statements concerning sympathomimetic adverse effects and beta-2 agonist therapy is incorrect? Option A. They may cause tremor due to skeletal muscle beta-2 stimulation. Option B. They may produce tachycardia through beta receptor activation. Option C. They frequently cause severe bradycardia in therapeutic doses. Option D. They may lower serum potassium via cellular uptake. Option E. They may cause nervousness or anxiety. The correct answer is option C. They frequently cause severe bradycardia in therapeutic doses. This is because beta-2 agonists typically cause tachycardia rather than bradycardia due to beta receptor stimulation and reflex responses. The other options describe recognized adverse effects such as tremor, hypokalemia, anxiety, and increased heart rate. Question 9. Which drug used for bronchial asthma treatment acts by direct beta-2 adrenergic receptor stimulation, unlike inhaled anticholinergics? Option A. Ipratropium. Option B. Salbutamol. Option C. Tiotropium. Option D. Glycopyrronium. Option E. Atropine. The correct answer is option B. Salbutamol. The explanation is that salbutamol is a selective beta-2 agonist that relaxes bronchial smooth muscle by stimulating beta-2 adrenergic receptors. The other drugs listed are anticholinergic agents that produce bronchodilation by blocking muscarinic receptors instead. Question 10. Which statement best describes the pharmacokinetic limitation and clinical use of catecholamine sympathomimetics? Option A. They are orally effective because catechol metabolism is minimal. Option B. They are rapidly metabolized by COMT and MAO. Option C. They readily cross the blood-brain barrier in high amounts. Option D. They have very long elimination half-lives exceeding 12 hours. Option E. They are eliminated unchanged through renal tubular secretion. The correct answer is option B. They are rapidly metabolized by COMT and MAO. This is because catecholamine sympathomimetics such as epinephrine are quickly degraded by catechol O-methyltransferase and monoamine oxidase, limiting their oral use and duration of action. The other statements incorrectly describe pharmacokinetic properties that catecholamines generally do not possess. The quiz is now complete, and thank you for taking part in this pharmacology review on sympathomimetics. I would love to hear how you did, so please drop your score in the comments. For deeper study, consider reviewing sympathomimetics in Katzung and Trevor's Clinical Pharmacology, Rang and Dale's Pharmacology, and the British National Formulary, with guideline references in this video aligned with the BNF. These resources will help reinforce the mechanisms, therapeutic uses, and safety considerations of these important drugs. Subscribe for more pharmacology quizzes and learning content.